There is a sensation that many people over 60 know intimately, even if they have never found quite the right words to describe it to someone who has not experienced it. It begins sometimes as a tingling, like the feeling of a limb falling asleep, that pins and needles sensation that everyone has felt at some point after sitting in an awkward position for too long. But unlike the tingling that resolves the moment you shift position and restore circulation, the tingling that many older adults experience in their hands and feet has a different character entirely. It comes without an obvious positional cause. It lingers beyond any reasonable explanation. It wakes people from sleep. It makes the simple act of buttoning a shirt or walking across a room in bare feet feel strange and unreliable, like the hands and feet belong to someone else or are receiving their signals through a damaged connection that distorts everything passing through it. And when people mention it to others, they often encounter a response that combines sympathy with a kind of resigned acceptance, a suggestion that this is simply what getting older feels like, something to be managed rather than investigated and addressed. That resigned acceptance, while understandable, misses something critically important. The numbness and tingling that so many adults experience in their hands and feet after 60 is not a single phenomenon with a single cause and a single implication. It is a symptom, or more precisely, a family of symptoms that can be produced by an array of underlying conditions ranging from the entirely benign and easily correctable to the serious and requiring prompt medical attention. The experience of numbness or tingling in the extremities deserves neither panic nor dismissal. It deserves understanding, the kind of understanding that allows a person to make informed decisions about when to simply observe and when to seek evaluation, about which changes in how the symptom behaves suggest urgency and which suggest the kind of manageable chronic condition that responds well to appropriate intervention. Understanding what actually causes the sensation of numbness and tingling is the foundation on which everything else builds. The sensations people describe, whether tingling, pins and needles, burning, a feeling of wearing invisible gloves or socks, or frank numbness in which sensation is reduced or absent, are all produced by disruption of the normal process by which sensory information travels from the skin and deeper tissues of the hands and feet through the peripheral nerves to the spinal cord and ultimately to the brain, where the information is processed into conscious awareness of touch, temperature, pressure, and pain. When anything interferes with this transmission process, whether by compressing the nerves, damaging the nerve fibers themselves, disrupting the blood supply that keeps nerve tissue alive, or altering the chemical environment in which nerve cells operate, the result is some variant of the abnormal sensory experience that people describe as numbness or tingling. The peripheral nerves that serve the hands and feet are the longest nerves in the body, making them particularly vulnerable to certain types of damage and particularly sensitive to systemic conditions that affect nerve health throughout the body. The length of these nerves means that the metabolic demands placed on the nerve cells that maintain them are substantial, and that anything disrupting the supply of the nutrients and oxygen that nerve maintenance requires will tend to affect these longest nerves first and most severely. This explains why the characteristic pattern of so many conditions producing numbness and tingling begins in the feet, the point farthest from the nerve cell bodies in the spinal cord, and progresses upward over time as more of the nerve is affected. With that biological foundation established, examining the 9 most common and most important reasons that hands and feet go numb after 60 reveals a picture of considerable diversity, from the mechanical to the metabolic, from the vascular to the nutritional, and from the quickly correctable to the conditions requiring ongoing management. Understanding this diversity is what allows a person to move from the vague and somewhat frightening awareness that something is wrong with how their hands and feet feel to the more useful and more empowering awareness of what specific factors might be contributing and what can actually be done about them. The first, and in many respects, the most common cause of hand numbness in adults over 60 is carpal tunnel syndrome, a condition produced by compression of the median nerve as it passes through the narrow carpal tunnel at the wrist. The carpal tunnel is a rigid passage formed by the bones of the wrist on 3 sides and a thick band of connective tissue called the flexor retinaculum on the 4th, and the median nerve, along with 9 tendons serving the fingers, passes through this passage to reach the hand. When the contents of the tunnel increase in volume relative to the fixed space available, whether through tendon inflammation, fluid retention, or any of several other mechanisms, the resulting pressure on the nerve produces the characteristic symptoms of carpal tunnel syndrome, which include numbness and tingling in the thumb, index finger, middle finger, and the thumb side half of the ring finger, the specific territory of the hand served by the median nerve. The characteristic pattern of carpal tunnel syndrome that distinguishes it from other causes of hand numbness includes the specific finger distribution just described, the tendency for symptoms to be worse at night and to wake people from sleep, the relief that comes from shaking the hand vigorously, which temporarily restores circulation and reduces pressure, and the worsening of symptoms with activities that involve sustained wrist bending or sustained hand use. This condition is considerably more common in women than in men, and becomes more common with age, in part because of the fluid retention and tissue changes that accompany hormonal changes, and in part because of the cumulative effect of decades of wrist use. It is also highly treatable, with options ranging from night splints that hold the wrist in a neutral position to cortisone injections to surgical decompression that provides permanent relief in the majority of cases. The important message about carpal tunnel syndrome is that it should not simply be endured as an inevitable feature of aging, because effective treatment exists, and because untreated compression of the median nerve over time can produce permanent nerve damage that is not reversible. The second major cause is peripheral neuropathy related to diabetes or prediabetes, which deserves extended discussion because of how extraordinarily common diabetes is in adults over 60 and because of how frequently the neuropathy it causes goes unrecognized as diabetes-related until after a formal diagnosis has been made. Diabetic peripheral neuropathy is caused by the combined effects of sustained elevated blood sugar on the small blood vessels that supply peripheral nerves and on the nerve fibers themselves. The resulting nerve damage tends to follow the length-dependent pattern already described, beginning in the feet and progressing upward over time, and producing a characteristic combination of numbness, tingling, burning pain, and in later stages frank loss of sensation that can result in the dangerous situation in which wounds on the feet go unnoticed until they have become serious. The tingling and burning of early diabetic neuropathy can precede a formal diabetes diagnosis by years in some cases, making unexplained foot tingling a meaningful reason to seek blood sugar evaluation even in the absence of other diabetes symptoms. The treatment of diabetic neuropathy begins with blood sugar control, which can slow its progression and in some cases produce meaningful symptom improvement, particularly in earlier stages before nerve damage is severe and irreversible. Specific medications can help manage the pain component of diabetic neuropathy, and nutritional interventions, including B vitamin optimization, can support nerve health in this condition. The third cause is vitamin B12 deficiency, which produces a neurological syndrome that can be remarkably similar in its presentation to diabetic neuropathy, including the same pattern of progressive tingling and numbness beginning in the feet that is so characteristic of peripheral neuropathy. The mechanism is different, but equally important to understand. Vitamin B12 is essential for the maintenance of the myelin sheath, the insulating layer that wraps around nerve fibers, and that is necessary for the rapid and reliable transmission of electrical signals along the nerve. When B12 is deficient, myelin production falters, existing myelin breaks down, and the resulting demyelination produces the impaired nerve conduction that manifests as tingling, numbness, and in severe cases, muscle weakness. As already discussed in the context of vitamins for senior health, B12 deficiency is remarkably common in older adults for the specific reason that the absorption of food source B12 requires adequate stomach acid and intrinsic factor, both of which decline significantly with age. The critical point in the context of numbness and tingling is that the neurological damage of B12 deficiency can be subtle in its early stages and can progress significantly before symptoms become severe enough to prompt evaluation, and that if deficiency is allowed to continue long enough, the nerve damage it produces may not fully reverse even with correction of the deficiency. Early detection through blood testing and prompt correction through supplementation or injection of B12 is therefore both achievable and important. Anyone over 60 experiencing unexplained tingling or numbness in the hands and feet should have B12 status evaluated as part of the initial investigation, given how common this deficiency is and how directly correctable it is when caught before irreversible damage has accumulated. The fourth cause is cervical or lumbar spinal stenosis, conditions in which the spinal canal or the openings through which nerve roots exit the spine have narrowed to a degree that compresses the nerves passing through them, producing symptoms in the areas of the body served by those nerves. Cervical stenosis, occurring in the neck portion of the spine, can produce numbness and tingling in the hands and sometimes in both the arms and the legs, while lumbar stenosis, occurring in the lower back portion of the spine, produces symptoms in the legs and feet. Both conditions become more common with age as the degenerative changes of the spine, including disc compression, facet joint enlargement, and ligament thickening, gradually reduce the available space for the neural structures that pass through the spine. The specific pattern of symptoms that suggests spinal stenosis rather than peripheral neuropathy includes the relationship between symptoms and body position or activity. Lumbar stenosis classically produces symptoms that worsen with walking and standing and improve with sitting or bending forward, a pattern that reflects the way spinal position affects the available space in the stenotic canal. Cervical stenosis may produce symptoms that worsen with neck extension and may be accompanied by neck pain, upper extremity weakness, or in more severe cases, difficulties with balance and bladder control that reflect compression of the spinal cord itself rather than individual nerve roots. The evaluation of suspected spinal stenosis involves imaging, typically MRI, and management ranges from physical therapy and targeted exercises to epidural steroid injections to surgical decompression in cases where conservative management fails to provide adequate relief. The fifth cause is peripheral artery disease, a condition in which narrowing of the arteries that supply blood to the legs and feet reduces the blood flow to these tissues sufficiently to cause symptoms. While peripheral artery disease is best known for causing pain and cramping with walking, called claudication, it can also produce numbness, coldness, and tingling in the feet and lower legs when blood flow is sufficiently compromised. The important distinguishing features of peripheral artery disease as a cause of foot numbness include the relationship to activity, with symptoms typically worsening during walking and improving with rest, and physical signs including reduced or absent pulses in the feet, which a healthcare provider can assess, coolness and paleness of the affected extremity compared to the other, and sometimes visible changes in skin texture and hair growth on the legs and feet that reflect chronic reduced blood flow. Peripheral artery disease is an important condition to recognize not only because of its direct effects on leg and foot symptoms, but because it is a manifestation of the systemic atherosclerosis that affects blood vessels throughout the body, and its presence significantly increases the risk of heart attack and stroke. Its identification should therefore prompt a comprehensive cardiovascular assessment and aggressive management of the cardiovascular risk factors, including blood pressure, cholesterol, blood sugar, and smoking history that drive its progression. The sixth cause is hypothyroidism, an underactive thyroid gland that produces insufficient amounts of thyroid hormone, which is extremely common in adults over 60 and particularly in older women, and which has neurological effects including peripheral neuropathy that are often overlooked in the diagnosis of its cause. Thyroid hormone is essential for the normal maintenance of peripheral nerve function, and chronic hypothyroidism can produce a peripheral neuropathy with tingling and numbness in the hands and feet that is indistinguishable from neuropathy of other causes without blood testing to check thyroid function. The critical importance of including thyroid function testing in the evaluation of unexplained peripheral neuropathy is that hypothyroidism is both common and entirely correctable, with thyroid hormone replacement producing complete or substantial resolution of the neuropathy in many cases, particularly when the deficiency is identified and treated before nerve damage has become severe. The broader symptom picture of hypothyroidism, which includes fatigue, weight gain, cold sensitivity, constipation, dry skin, hair loss, depression, and cognitive slowing, along with the neurological symptoms, is important to recognize because these symptoms are individually common in older adults and are frequently attributed to aging or to other conditions rather than to the single underlying hormonal cause that would respond to treatment. Any older adult experiencing unexplained peripheral neuropathy, along with several of these other symptoms, should have thyroid function evaluated as a priority. The seventh cause is Raynaud's phenomenon, which differs from the other causes on this list in its mechanism and its presentation. Raynaud's involves an exaggerated vasospastic response of the small blood vessels in the fingers and sometimes the toes to cold temperatures or emotional stress, causing these blood vessels to contract dramatically and temporarily reduce blood flow to the affected areas. The result is a characteristic color change sequence in which the affected fingers turn white from lack of blood flow, then blue from deoxygenation of the blood that remains, and then red as blood flow is restored and reactive hyperemia occurs, accompanied throughout by the numbness, tingling, and pain that reflect the temporary ischemia of the nerve and skin tissue. Raynaud's is considerably more common in women than in men and affects a significant proportion of adults over 60, either as a primary condition without underlying disease or as a secondary manifestation of various connective tissue disorders, including rheumatoid arthritis, lupus, and scleroderma. Management includes behavioral measures, most importantly, avoiding cold exposure and keeping hands and feet warm, and in more severe cases, medications that relax blood vessels to prevent the vasospastic episodes. The important point about Raynaud's in the context of this discussion is that its characteristic pattern of color change and its clear relationship to cold exposure or stress usually makes it distinguishable from other causes of hand numbness, but that secondary Raynaud's associated with an underlying connective tissue disorder warrants further evaluation to identify and manage the underlying condition. The eighth cause is certain medications. A consideration that is particularly important for older adults given the number of medications that are commonly prescribed to this population and the significant number of those medications that list peripheral neuropathy or numbness and tingling among their known side effects. Several classes of medications deserve specific mention. Statins, which are among the most widely prescribed medications in the world for cholesterol management, are associated in some patients with a range of muscle and nerve effects, including peripheral neuropathy, though this is less common than the muscle symptoms more frequently attributed to statins. Certain medications for diabetes, most notably metformin, can reduce vitamin B12 absorption over time through effects on the gut that impair B12 uptake, indirectly causing the B12 deficiency neuropathy already discussed through a medication-related mechanism. Certain chemotherapy drugs, if any older adult has received cancer treatment, are well known for their neurotoxic effects on peripheral nerves, producing a neuropathy that can persist long after treatment has concluded. Certain antibiotics, including metronidazole and nitrofurantoin, can cause peripheral neuropathy, as can certain medications for heart rhythm disorders, including amiodarone. The practical message is that any new or worsening numbness and tingling that develops after starting a new medication, or that is present in someone taking several medications, warrants a specific review of those medications with a healthcare provider to determine whether medication-related neuropathy may be contributing and whether any medication changes might reduce symptoms. The ninth cause encompasses the less common but clinically important conditions that need to be considered when the more common causes have been ruled out, or when the clinical picture has specific features that point toward them. These include vitamin deficiencies beyond B12, particularly thiamine deficiency, which produces a form of neuropathy with similar features, and copper deficiency, which is less common but can cause a neurological syndrome with similarities to B12 deficiency neuropathy. They include inflammatory and autoimmune neuropathies in which the body's immune system attacks peripheral nerve tissue, including conditions called Guillain-Barré syndrome in its various forms, and chronic inflammatory demyelinating polyneuropathy, both of which require specific immunological treatment. And they include the neuropathies associated with various systemic diseases, including kidney disease, liver disease, and certain blood disorders that can produce peripheral neuropathy as a manifestation of their broader effects on the body's chemistry. The common thread running through all 9 of these causes is the importance of evaluation rather than acceptance. When numbness and tingling in the hands and feet is new or worsening, when it is affecting daily function, when it is accompanied by weakness, when it is associated with other symptoms suggesting an underlying systemic condition, or when it simply persists without an obvious explanation, seeking medical evaluation is the appropriate response. The evaluation process for peripheral neuropathy typically begins with a thorough medical history and physical examination, followed by blood tests to assess the common correctable causes including blood sugar, B12, thyroid function, kidney and liver function, and other relevant parameters depending on the clinical picture. Nerve conduction studies and electromyography, tests that measure the electrical activity of nerves and muscles respectively, can provide more detailed information about the type, the severity, and the distribution of nerve damage that helps direct further investigation and management. For people living with any of these conditions, the management of the symptoms themselves, the tingling and the numbness and the pain, is a legitimate and important aspect of care alongside the treatment of whatever underlying cause can be identified and addressed. Several approaches have evidence supporting their effectiveness for symptom management. Regular gentle exercise, particularly activities that promote circulation to the extremities, including walking and swimming, supports nerve health and can reduce symptom severity. Careful attention to foot health, including regular inspection for wounds that reduced sensation might allow to go unnoticed, protective footwear, and prompt attention to any skin changes is critically important for anyone with significant foot numbness, regardless of cause. Temperature regulation, keeping hands and feet warm, particularly for those with Raynaud's, supports comfort and function. And the nutritional foundations of nerve health, adequate B vitamins, and the other nutrients discussed in the vitamins piece in this series support the body's ongoing capacity to maintain nerve function as well as the biological conditions allow. The numbness and tingling in hands and feet that so many people over 60 experience is not an anonymous consequence of aging with no specific explanation and no specific remedy. It is a message from a nervous system that is being stressed in specific ways by specific conditions, some entirely reversible, some manageable with the right treatment, and some requiring ongoing support and careful monitoring. Receiving that message with curiosity and appropriate action rather than resignation is what transforms the experience from something simply endured into something understood and addressed. The nerves of the hands and feet are communicating something important. Understanding what they are saying is the first step toward being able to respond in a way that genuinely helps.